Blood pressure is the force exerted by the blood on the blood vessel walls. The components of blood pressure are systolic pressure and diastolic pressure. Systolic pressure is the peak or the highest pressure. It is caused by ventricular contraction. The normal range for systolic pressure is typically less than 120 millimeters of mercury. Diastolic pressure is the lowest pressure. It is the effect of ventricular relaxation. The normal diastolic pressure is typically less than 80 millimeters of mercury. The equipment for determining blood pressure is the blood pressure machine known as the sphygmomanometer. This consists of an inflatable cuff and two tubes, one connected to the pressure handle control bulb and the other to the pressure gauge. The cuff is made of a non-elastic material and is fastened by a Velcro overlap. The inflatable bladder is located within the material of this cuff. The mercury manometer gauges are marked with long lines at each 10 millimeters of mercury, with shorter lines at 2 millimeter intervals between each long line. The stethoscope is the listening aid that magnifies the sound. The first step in measuring blood pressure is to locate the palpatory reading. The palpatory reading is found by placing your fingers on the radial pulse, pumping the cuff until the radial pulse is no longer detected. This is your palpatory reading. Look at the dial and then pump 20 or 30 millimeters of mercury beyond where the radial pulse was no longer felt. This is the maximum inflation level, or otherwise known as the MIL. Unless the MIL is determined, the level to which the cuff is inflated will be arbitrary. Excess pressure can be very uncomfortable for the dental patient. The cuff must be deflated and placed on the patient's arm, which is supported at the level of the heart. It has been shown that when the arm rests on the arm of the dental chair, this may cause a slightly higher diastolic pressure. Place the portion of the cuff that contains the inflatable bladder directly over the brachial artery. The lower edge of the cuff is placed 1 inch above the antecubital fossa. Position the stethoscope earpieces in the ears with the tips directed in an anterior forward position. The stethoscope endpiece or diaphragm is placed approximately 1 inch below the antecubital fossa in the location of the brachial artery pulse. Hold lightly in that position. Deflate the cuff gradually, releasing approximately 2 to 3 millimeters per second so that the dial drops very gradually and steadily. Listen for the first sound. This is a tap-tap or systole sound. This is the beginning of the flow of the blood past the cuff. This is your systolic reading. Continue to release the pressure slowly. When the last distinct tap is heard, that is your diastolic pressure reading. You will then release further and completely deflate the cuff. If there is a need to repeat the blood pressure readings, you must wait 30 seconds before re-inflating the cuff. You will record the blood pressure reading on the health history. You will write the date, and you will record the blood pressure as a fraction. For example, 110/70, with the palpatory reading indicated below as 90 in this example. Dental personnel have an obligation to advise and refer for further evaluation if necessary. Diagnosis of hypertension would never be made or treatment started on the basis of an isolated reading. If there is an indication of hypertension or a patient is being treated for hypertension, the blood pressure is remeasured and recorded at each dental hygiene appointment.